Darm, please call the roll.
Okay, so just to let you know, the mics are on the ceiling, so just project a little bit. And then Commissioner Tellez, if you could unmute your line. Commissioner Barrios?
Here.
Commissioner Carter?
Here.
Commissioner Doyle? VP said he had a conflict today. Commissioner Farron?
Here.
Commissioner Hatch?
Here.
Commissioner Micah?
Here.
Commissioner Russell?
Here.
Commissioner Smith?
Here.
Commissioner Young?
Here.
Commissioner Tellez? Well, we'll hunt down Commissioner Tellez, but we do have a quorum, Madam Chair.
All right, quorum is present. Thank you so much. We want to thank everyone for attending today's meeting. We're excited to welcome our new board members to the commission. I know it is my first time, so I am really excited to be here with all of you. So I think now is a great time for everybody to introduce themselves to one another. So if each of the commissioners could say hello, maybe a fun fact, however you want to do that to introduce yourself to the room. So not to call you out, but Commissioner Young, would you like to start first?
Chris Young from Panama City, Florida, and Mike Flong. I don't know what you want to say. And Bob and I are from the same area, so. But what else you want to know?
That's good.
Now, I'll give you anything else you want to know. So,
And practice, what kind of law do you practice?
personal interest, I'm a trial lawyer.
Okay.
Yeah.
So now we all know that. That's perfect. All right.
Yeah, absolutely. I'll go next. My name is Melissa Smith. I am with the Florida Department of Transportation. I serve as the Chief of Modal Development for the Florida Department of Transportation. I've been in state government for well over 15 years now, in both policy and budget sides of that, working in legislative and executive, and very excited to continue on with the commission and excited to see a full membership here today. Looking forward to it.
Good afternoon, Taylor Hatch. I'm so appreciative of the governor, the honor of serving as the director for the Agency for Persons with Disabilities. And we get to serve a very sacred population of Floridians. And inevitably, a lot of the things that we talk about at our agency, our client goals are all interconnected and relate back to transportation somehow. And so we really appreciate the opportunity to serve in this capacity and alongside all of you. Thank you.
Bob Micah, I'm from Bay County, Panama City area. Primary background in fire and emergency services for most of my career. Came into county administration in the the early 2000s, and have been involved with our transportation platform, transit system in my role as county manager. So just again, appreciative of the governor asking me to serve and looking to be of service and do what I can do to help out.
I will go last. So Commissioner Carter. Hi, Krista Carter, Department of Elder Affairs. I've been with the commission since 2019 and Chief under Elder Rights, Department of Elder Affairs. So we work with our senior population and programs to help protect their rights, keep them from being exploited, abuse, neglect, exploitation, anything you think of, we work with our seniors. So I'm happy to be here and I'm happy to be able to assist with the transportation aspect of that as well. Commissioner Barrios?
Hi, I'm Lillian Barrios. I live in Tallahassee. I currently work for the Public Service Commission, but I am here. This is my third year, I believe, on the commission, representing riders, customers. So glad to be here.
Commissioner Farron?
Good afternoon. My name is Samantha Farron. I'm the Senior Government Relations Director for Elevance Health. We are the second largest provider of healthcare services in the country. In Florida, we do Medicaid statewide, Medicare, behavioral health, a lot in the pharmacy space. Prior to that, I worked for the state for over 10 years. So I have a background in contracting and procurement. Really excited to be here and very thankful for the appointment from the governor.
Do you want to introduce yourself?
Absolutely. Good afternoon. I'm Rochelle Munson. I am legal counsel to this wonderful commission, and I think I've been serving as counsel for, I don't know, maybe about 4 years or so. I'm with the Office of the Senior Assistant Attorney General. And as some of you may know, with that particular office, we are assigned various floors, we each have 7 or so. And this esteemed commission happens to be one of them.
So 2 lawyers in the room. So we are very safe. That's great. Monica Russell, I'm married to a lawyer, so I get to make jokes. I don't do that. Monica Russell has been named chair of this commission, which I'm greatly honored to be able to do and to serve alongside of all of you. I was born and raised in Florida. I've been in Tallahassee now. I don't remember how long, really, 2008. So I've lived in Tallahassee since 2008. I did not go to school here, however, but I will not tell you which one I went to because you all know about that. And okay. Well, hey, this is going to be great. Okay. Went to that other school that shall not be named City of Tallahassee, but I presently work for KPMG. Prior to that, I've had about 20 years within state government. So I have a true affinity for what you all deal with and the clients that you serve. And I know how hard those jobs can be and making sure that we are truly doing things that is for the betterment of our constituents. So that is my goal here while serving on this commission. So let's see. So before we move into our agenda, we'd like to go over some meeting rules. This is a public meeting and operates under Florida's Government in the Sunshine Act, which we'll discuss further during our general counsel's presentation. This meeting is being recorded and all verbal, written, and text feedback will be logged within the meeting minutes. For those participating on the webinar or phone, we ask that you please mute your lines. If you're experiencing technical difficulties, please comment in the chat box and someone from our team will try to address your concern. We will provide an opportunity for public comments toward the end of the agenda. We've asked those wishing to speak to submit a public comment form prior to this meeting, and we will call on the speakers in the order the requests were received. The agenda and materials that will be presented in today's meeting are included in the packet that was sent out and posted on the CTD website last week. We will follow Robert's Rules of Order. For agenda items requiring action, a board member must make a motion. Another member must second that motion for an item to be voted on by the commission. Are there any questions on any of that so far?
See if Commissioner Tellez joined on the phone. She was having trouble with Teams.
I still don't see her.
Okay, well, we'll keep trying to get her patched in.
Okay, so we have our first item here. So our first agenda item requires action. Chapter 427 Florida statutes provide the vice chair of the commission shall be elected annually from the membership of the commission. The vice chair is responsible for facilitating the board meetings when the chair is not present. The position is currently vacant. I promise I am super fun. So this would be a really great gig for anybody who wants it. So at this time, I'd like to ask if any commissioners would like to be nominated or nominate another board member to serve as the vice chair.
I would like to be nominated.
You would like to be nominated?
Yes.
Okay. On the record, Commissioner Barrios.
I'll nominate myself, Volty.
Commissioner Smith would also like to be nominated. Good, a good, okay. Well, do we want to offer each commissioner a platform here for a minute? Commissioner Barrios, would you like to go first?
I'll go second if that's okay.
Okay.
Yes, thank you. So with a background in government, I would love to serve further in this capacity, being a part of the commission now for almost a year into it for its new makeup of that one too. And with the transportation backgrounds and abilities for what we're going into for resources, I would enjoy serving beside you if that is the will of the commission that comes beside this one to be it.
Thank you very much.
Thank you. So I've been on the commission for, like I said, 3 years. My background is public health. Transportation is a huge part of that. But also, as I said previously, I'm here representing users as an individual with disability myself. I've had experience working with veterans and VA and with the public, through DCF and the Public Service Commission. And yeah, I'd love to serve if I get the chance. Appreciate it.
Thank you very much. Do any of the other commissioners have a second for either of our candidates?
I'll second Melissa Smith.
Okay, being we have a second for Commissioner Smith, do we want to vote on that or is it only?
So I guess the motion is officially from Commissioner Smith. Second is from Commissioner Farren, and then
Correct.
discussion, and then we vote.
Okay, so discussion? Or we only vote on the first and second?
No, so I just want to make sure I understood what it just happened. So we have a self-nomination by Commissioner Barrier, self-nominations by Commissioner Smith. And
Only a second for Commissioner Smith.
so with all a second, move forward with that nominations.
Okay, so then we only vote on Commissioner Smith? Just making sure, you guys really tested my Robert's rule.
Right off the bat.
Right on. Yeah, that's okay though. All right, so we have
I
a,
just want to make sure that everyone understood what just happened. I know we do have, we have the self-nominations, you should have, since we have the self-nominations,
you still need the second though, right?
you need seconds for a motion. I don't know if you need to have,
Do you want me to go back? I can nominate Melissa Smith if we need to fix the process.
Okay,
I don't think there's anything in the rule that would prohibit self-nominations. It's just that we don't usually see that.
it was in the notes. So I thought.
Yes. Experience it too. We're all.
Vote on the vote or what do we do?
I have a feeling that, it's not a feeling. All I think would require that because you have two names out there, I don't think you need a motion to actually vote on someone who's doing so. I just, you have two parties who have been nominated and you could just vote for each of them by however, I don't know if you're doing it then.
Okay. So all in favor of Commissioner Smith being elected as the vice chair, say aye.
Aye.
Okay, okay. All in favor of Commissioner Barrios being elected as the vice chair, say aye. Okay. Okay, so we officially, Melissa Smith, thank you so much. You are officially the vice chair.
Congratulations.
Congratulations. Thank you both for being willing to put your names in.
Commissioner Tellez is on.
I think we've heard. Yes. Commissioner Tellez, have you been able to join us?
Yes, can you hear me?
Yes.
Yes, I voted.
Yes.
We heard that.
Would you like to take this opportunity to introduce yourself? I know we kind of went through that quickly before you were able to sign in.
Yes, thank you so much. I'm sorry I'm not there in person, but I am Dr. Robin Tellez. I've actually been with the Commission for the Transportation Disadvantaged since 2016. I reside in Miami-Dade, Florida, and I really started my interest, my passion is really working with those with disabilities. Prior to my retirement from Baptist Health South Florida, I worked in HR. I am a registered nurse for over 40 years, but my passion really was working with people, hiring persons with disabilities, and I created a program called Aspire, and that's what we did. We went into the community and really worked with many of the agencies to seek out individuals who wanted to work, and we had paid internships, which turned into full-time employment. So thank you very much. I really have enjoyed working with the commission and am excited with this new team of people we have and look forward to meeting you all in person one day.
Thank you so much, Commissioner Tellez. I am familiar with Aspire and it is a great program. So I am very impressed that you created that. So I'm looking forward to meeting you in person at one of our upcoming meetings, I'm sure.
Absolutely. Thank you.
Okay. So we'll go back to the agenda. So now we have our first presentation, which is Ethics and Government in the Sunshine. We'll now recognize our General Counsel, Rochelle Munson, to provide a presentation on the laws pertaining to ethics and government in the sunshine.
Yeah, thank you, Madam Chair. This presentation is going to be fairly brief. I know that most of you in the room are familiar with state government, so I'm not going to inundate you with what may be something that's very well attached to your knowledge, but I would like to just start with just a few basic things. The information that you've noticed in your outline are just really the basics of what we need to make sure that we adhere to in our meetings. So yeah, Florida is a state that recognizes government in the sunshine. We do not act in private. We cannot act in private. I mean, there will be, there is a purpose in the fact that the citizens of the state of Florida will have to get what the business of the state of Florida is. So unless there are certain circumstances such as shade meetings or other meetings that would give us some type of province to do so, all of our discussions will need to be in public. And I think I just want to just outline that or just state that at the outset, because it's just the most foundational information that I think would keep us out of the most trouble. So please understand that the commission has its staff, and they're an amazing staff. And the commissioners have their individual roles. Congratulations to each of you, by the way, for your appointments by our governor. And my role is here to serve the commissioners. I'm here to make sure that you guys don't get in trouble. Please don't do anything you're not supposed to do. I mean, of course, you're going to act independently, but I just want to make sure that if you have any questions about anything, you kind of know where to go to ask. I mean, our Ethics Commission area, which is also under the state of Florida, is available. I rely on them a lot. So when you look at what my role is, I try not to blur the lines as much as possible, because I want everyone in the room who serves as commissioner to understand that I am really here. I want to say to protect you, because it's not necessarily that you need protection, but I want to be a resource to you that you find very valuable. So having said all of that, I'll just go through the outline with you. The topics for the day are clearly outlined. Okay, it's right in front of us. We understand that this is a commission, Florida Commission for Classification Disadvantage, and we are existing on the foundation of statutory authority. Our statutory authority rests in chapter 427 of the Florida statutes. All of the information that you would need as far as guidance in that area would be found in that particular chapter. It's available on the commission's website. You have it in the packet. I was going to say that it's very helpful that you familiarize yourselves with it, right? It's a lot of technical stuff. I mean, like I said at my particular introduction, those of us who work with the Attorney General's office, we hold our function is with various different boards and commissions. And I will say that the work that the Florida Commission for Transportation Disadvantage does, of course, it's in fact necessary, but some of it is very technical. Some of it is very mathematical. A lot of it is some stuff that you just may not be in your resource, right? So it's good to familiarize yourselves with it so you can see what really makes this shift work. I can assure you that the staff and all of the consultants that may be available through the leadership of this staff is very helpful in understanding it. Director Darm has done incredible work with webinars to help build through some stuff. There are so many sub-organizations that rely on what this commission does. And that's when the work becomes very, very technical. So chapter 427 and in large is this area that you would probably just read over. It's not large, but just read over, just so terminology, understanding the processes can just seem a little bit more familiar to you, because it's not something that you're going to know to think about when you wake up in the morning, like you have with a bowl of cereal or something. And of course, the rules that we rely on are based on, I believe it's 41-2. It's only one chapter in our rules for the administrative code. And that's where all of, again, our legal guidance comes from. So between those two legal areas, that's the framework that we have to work within. Make sure that we are functioning within our legal guidelines as a commission. You will note that I'm going to touch on just a few areas already highlighted just right off the gate, that government in the sunshine is like the highlight of everything that we need to do. And many of you are familiar with various work with other boards, so you're familiar with what requirement really means. So we're going to talk a little bit more about that. We're going to talk just very little about how that impacts us with public meetings, public records, and what this whole ethics consideration really is concerned about. I'm going to touch on what our definition of quorum is, very lightly on dual office, and also just a little bit on antitrust. I don't think it really hits this area. It hits other boards more than it would this, but I just, that's a term out there. that I think you should at least be familiar with understanding as it comes up in any type of discussion or conversation. So as we move forward, I've highlighted that. Oh, Brenda, I don't have to do this. It's just it's flashing. Okay. Listen, chapter 120 is an area or a chapter in the Florida statutes that I did not mention previously because it's not limited to just the commission, right? Chapter 120 is what every governing agency needs to follow as an administrative body. I technically have referred to it as an administrative Bible because that tells you what to do with public hearings, how to handle notices, how to go through any type of appeals process, how to interact with the public. Expectations that are definitely made available have been memorialized in chapter 120 that impacts every single governing agency that operates in the state of Florida as a governmental agency. And again, 427 is limited to what we do in the commission. And I think that your information just has a quick link so you can find it easily. Director Darman indicates it's in the notebook that he's provided today. And of course, 41-2 as far as the Florida Administrative Code. I will just highlight that very recently in the very last legislative session, there were a couple changes. Not too many changes occurred, but this last session, there were a few that occurred. One of them being chapter 427.012, and I think that's the one that deals with adverse incidents. We're going to have a lengthier discussion, maybe not too lengthy, but a lengthier discussion in the meeting later this afternoon about some changes that we need to consider and quite frankly implement so that we can adhere to what this statutory, I don't want to call it a change because it's new, the statutory requirement now is placed upon this particular commission to enforce. So you will have a larger discussion about that momentarily. And of course, 427.013 is just, it's a general outline of the purpose and responsibilities of this commission. The changes in that include, we have such a larger commission now, and it's exciting, right? So so that's some of the changes that occurred with the last legislative session with regard to it. Again, most of it had not changed, but minor changes like that has occurred for the betterment of the commission. I think I just like to add. So in addition to the access, we've done that. Charlie, look, I'm just gonna read and I'm gonna let you do that, because if I look and read, I come to find myself in a couple of times. Let me talk a little bit about government in the sunshine. And again, very, very quickly, chapters 286.011 and 286.012. Actually, when I get the full information from each of the commissioners, I'm probably gonna shoot you what I'd just like to give as a reference guide, so you can have at your fingertips certain things available to you. So about this, this is how, so you can just kind of have it as a resource for as you're going about doing the business of the commission, I should say. But government in the sunshine just pretty much lays out that all of our meetings are in the public. So we have to send the notices out within 7 days of a meeting. We have to make sure that our equipment is available so that if anyone wants to join in, they have the opportunity. These meetings are set hybridly, so we do them in person or we simultaneously make them available digitally. So we have to make sure that there's room for folk, there's video and equipment. They have the link to if they want to just join us via Teams, as most of these meetings are set up. And if for any reason we have any glitches in any of those areas, we would be in violation of that particular area. Our government in the sunshine for our public meeting requirements. So it sounds like it's something that you would just know and perhaps take for granted, but those technical things. So we've had a couple of meetings with some glitches where I've had to pull a couple of staff members aside and say, are we sure that this is the right link? Because if it's not, I would have just said, I don't think we have a meeting today.
I have scar tissue.
So it's really a thing. So I just highlight it only because every part of it is very important. It's the government in the sunshine, again, based on chapter 120, we have to live by it. I'm a rule of law person, so I don't deviate if I don't think that the laws would allow us to. Very seldom would they. So having said all of that, I would also like to note that the information that we share is published. So not only is it in time is our information made available to the public, we publish the information so anyone can request a public record of it. They can see what we talked about. The director and his leadership staff are really good at posting stuff on the website. So they go beyond, I believe, and to some extent to make sure that all the information that covers or that has occurred as a result of a webinar, as a result of a meeting, it's so hands-on available, and I'm very comfortable with the way the dissemination and availability of it. I'd just like to, again, thank the staff for that because it's extremely important. I want to note that it says certain actions by the commission members are prohibited. There's an understanding that when appointed to boards such and commissions such as these, that you are that person in that role, like all the time, right? You can't just leave this meeting and say, well, I'm no longer a commissioner, so I can talk about this. You kind of wear the hat all the time. So I kind of give you analogize it a little bit as if you are wearing a hat. So when you're conducting yourself outside of the confines of this public meeting, which means there are no confines, really, look, but outside of the meeting space, understand that you're still representing the state of Florida as a commissioner. This sounds perhaps very, it sounds like this would be applied to a novice, but I just think the information is so foundationally important that sometimes we are so accustomed to speaking and doing our actions and our words. We may not always remember that we're always wearing that hat. So I just kind of like to highlight that. I have a lot of commissioners and members of other boards who speak at a lot of public events because that's what they do. I mean, I'm sure the appointment is a result because you are doing such amazing work in society at large. So you are involved in so many different things. And many of you are involved in governmental areas, which you also have to be very, very wary of and aware of as well. So just be mindful that wherever you are, whenever you're speaking in public, having conversations with when you're speaking in public, and there's another ear that could possibly pick up that with everything else that you're doing in your very full life, they're going to tag that I heard Commissioner had to say. And this is not going to be I heard Taylor say, depending on what they're doing with whatever information they may have heard. And it's just a part of it, right? It's just a part of it. But just to be mindful of it, I think it's just very, very important. When we're sitting in our public meetings, and our meetings are not attended by large numbers of people usually. I don't think over the years I've not seen that. But we do have a digital audience, and I don't know how many of them can see what we're doing. We can't always see them because they're off camera. But as far as whether or not they can see what we're doing, I'm not always sure about that. But because it's a public meeting and you may want to, Commissioner Barrios may want to lean in to Commissioner Farron to say something, okay, that could be problematic, right? Because they want to know, what was that whisper about? This is public information and they're not sharing it. It could have been nothing. I like your dress, but they don't know. So little things like that that you don't think anything about. You're doing what you do, and Commissioner Farron may know Commissioner Young, and she might be sending him a text about something that's on the agenda. Well, we can't do that, right? Because then we have lost our visibility in the public eye. Sounds extremely simple, but because I have only lived and seen this for so long, I've been in state government, don't want to date myself, but decades, I'll just say that. And leave that plurality alone. But I've seen it happen so often because you just become so familiar and you know you're doing a great job, but you're so comfortable in what you're doing that sometimes you forget. Or maybe I shouldn't have done that. So no whispering, no communicating, no sending an email about commission business outside of a commission meeting. Send it to the director, the leadership, and then they can determine how they're going to disseminate it. Because once Commissioner Young, which is send it to Commissioner Farron about anything on this agenda, that's the violation. And fines are attached if someone were to say something. And do I say, does it ever come up? No, but I've not seen it. But there are ethics opinions out there from our Attorney General. If you check with the ethics department, there are enough information that's been compiled where those violations exist. I'm grateful that I've just never been privy to them in settings such as this. And I never want to be so. That again is my role for this. With regard to anything that we need to vote on, you don't have the opportunity to abstain from a vote unless you are officially recused. So you may feel as though, well, I kind of know this person and, or I'm familiar with this particular agenda item, so I'm just gonna abstain. Well, you have to first disclose what your relationship is. It's public, and the public record, the minutes gonna need to reflect that. And then you're gonna have to recuse yourself. But if you are not recused, and your recusal can come as a result of you have some type of conflict, there's some type of monetary gain or loss that perhaps you're impacted by with that particular agenda item, all of which you would need to disclose, by the way, and publicly disclose at a meeting, because if it's on the agenda and they see a commission not voting, the question is gonna be, why did that commission not vote? We have to make that really clear. I'm not voting because I'm recusing myself, or I am voting because I still can vote on this impartially, but I need to disclose this relationship. Whichever direction you're gonna go in, you're still gonna have to disclose it. But just be mindful that, if the director is needing to take a vote, and we didn't hear, you heard Commissioner Tellez earlier, I voted because if I don't hear you voting, I'm not gonna know that you voted. If I don't see you, I'm not gonna know. I'm looking around, I'm getting familiar with voices to know that everybody voted, because everyone, absent a recusal, has to vote. You don't have the luxury of abstaining. I think I probably beat that nail in the ground. So, you see that there are violations, or penalties attached to the non-criminal fine up to $500. A knowing violation of, any government in the sunshine public meeting is, considered a second degree misdemeanor. So the state of Florida considers this, takes this very, very seriously. I'm gonna just lightly touch on a small discussion on public records. In chapter 119 in the Florida statutes is the chapter that governs all public record considerations for every government. I'm looking around the room because I'm like, I can't want here knows this, but I want the record to reflect that it was presented to this commission at this meeting, with the amazing number of commissioners that we have before us. So I believe that each that Director Darman and his leadership has a particular protocol that if there's a request for any document, what they need to do to produce those records, who the person is, who the contact person is. If there's ever any question, I would definitely encourage any commissioner just call the office and see, well, what about this? Or even with your maintenance of your emails, if you have any type of, it's not required, it's a suggestion. I know that many individuals who work on boards, many commissioners, many board members, they create a separate email just for their work on that commission or that board. Because if there's ever a question about, I received an email about whatever that the director said, and someone says, I want to see that email. You can't find it. They might be trying to get your entire batch of emails, but you don't want those released. So if you can just kind of contain them in just a special place, if they're ever requested, I usually would tell anyone that if you get any email that's commission related, board related, forward it to the office staff. Let them be the compiler of information for you. So it's not where it got lost or I forgot, and then there's a sense of something being hidden or something being not available. Again, sunshine, again, availability. It's just a suggestion. It may be easier. I don't think that this commission has to deal with things like that, but I don't know what the future holds, and I want you to be prepared for whatever. Right? So I think that's with regard to what documents constitute public records. I think this outline pretty much identified is pretty much almost anything. So just be aware of that as well. I mean, photographs, recordings, as anything that has documented some business of this commission, unless it's otherwise deemed confidential by some exemption, it's public information. Period. And yeah, that's just something that we just have to keep in the forefront of our day-to-day and our function in the commission. Ethics. Chapter 112, Part 3 of the Florida statute specifically references our responsibilities, the state of Florida as a member of this commission. you see information regarding the commission on ethics, I can tell you that when I say I communicate with them on a fairly regular basis, it's because they are just that reliable. But I want each commissioner to understand that the information made available is available to you. You can call and ask them absolutely anything. They're going to get an attorney on the phone. They're going to ask you specifically what it is, and they're going to find an answer for you. So I don't know everything about everything, but when it comes to anything ethics related, they do. And if you don't have any other information regarding what may or may not be appropriate in your conduct or in your interactions, in your relationships, in your disclosures, financial disclosures, whatever type of disclosures, I promise you that is an area that you would need to contact. That is the office. Because that is what they do every day, all day. If you were to call me and it's a gray area, I'm calling them. I mean, that's why we are there. So I wanted to make sure that you had their information and their phone contact information. They're not gonna, just talk to them before you do something. Before you run for something, before you want to engage in something, if you think you're about to purchase something and you don't know if you're gonna have to disclose that purchase, talk to them. That is why they are there. And you don't have to go to me because it's your personal business, right? You can just go to them and they can tell you exactly what you need to do. If you go to me, if you come to me, if you come to the staff, I'm gonna encourage whoever you go to, if there's a question, let's check with the commission on ethics on this, because we just don't want any issues to develop as a result of lack of knowledge. That's unnecessary with the resources that the state of Florida is needed. We're gonna do that. So you've seen me touch on financial disclosures. I don't think that we've done financial disclosures with them yet. Everybody's brand new. We have just, as soon as you come on, you have a financial disclosure form to fill out. If you have not seen it, you will. When you leave, you have to submit it within 30 days after leaving the commission. Again, this is all secondhand knowledge, but I want to just note that it's at least made known that these are the expectations. If you haven't received it yet from staff, you will be receiving it shortly because it's a requirement to file this. I think it's Form 1 with for your financial disclosures. For whatever reason, it's all documented, and that's what part of the appointment entails. There are certain gifts that you just can't take. I mean, I think the cutoff is like $25. You definitely can't take anything from a lobbyist. I don't even care if $5. I'll tell you not to take it. If you're going to interact with a lobbyist, just say thank you, but no thank you, and do something else. And when I say gifts, it could be a dinner. It could be, and I get this question all the time because we seem to be in an environment where everyone knows everyone. We interact with so many people that are our friends, right? So we have expectations about having those personal relationships. I would just be mindful that if you are interacting and with someone who may have the potential of bringing something before the commission for consideration, that you try to find a way to just draw a line, just as far as that it does not even give the appearance of impropriety. Because, I mean, everyone knows intentions are great. But then there's some folk out there that just kind of looking to see, man, we don't even entertain things like that. We're going to walk in a line that is such that there's really nothing to say because we understand what the expectations are and we're going to follow them, period. That's just the cleanest way to do it. But it does not in any way require that you can't maintain personal relationships. But if you're at, what's it called, dope saving? I didn't go to FSU. I would say for the record, I'm a gator, but just leave that alone. What is corrected on? But I mean, I've attended enough events and environments such as that where I wanted to just thank you so much for the lunch and to say no thank you. I'm gonna take my receipt and let it be known that my food was not on anybody else's ticket. Of course, never gonna let them buy liquor for me because we don't do that. Record. But things such as that you may not think about because you're just, you're comfortable. But in this role, we just have to remember that the hat never leaves. It just doesn't get tilted. It's not lifting though. So I guess the underlining theme of that is I mean, we're all adults in very high respected positions doing amazing work for the state, and we just have to be mindful. Because sometimes it's easy just to copy. We just have to be. So with regard to our, I was gonna say something about absences, but I think I will. So it's important to attend the meetings. I just stuck that in there because I'm gonna talk about the quorum in a minute, and I guess that just segues like into that. So I think we have a commission now at 11.
Yes.
Right,
Well,
that's you.
10
10 currently appointed.
current members.
11, an opportunity for 11 statute. So a quorum for that would be 6. So we can't have a meeting unless we have that quorum present, right? But we really can't really conduct like comprehensive, really relevant business if we maybe only have 7. Like we want to make sure that the commission is as much invested and involved in this so that some of these decisions that are going to really impact a lot of these local governing entities, the CTCs and all the other entities that you will learn who are new to the commission that are going to lean in and rely on how you are calculating how this money is spent and how they're going to do this and that and why can't they do that. You want as much input from all of the commissioners as possible. It will make a difference. So where it would be great to always have a quorum, it will be even more effective. We can have as many commissioners, and I wasn't going to mention it because we don't really have an attendance issue. We make the most meetings available perfectly as well, so that helps a lot. But please, we don't meet that often either. So if you can attend a meeting, please, we may change the date so you can attend. That's how important your valued input is to the commission. And I think that's all I need to say about that. As I wrote to the end of this or moved to the end of this, it's just the information about this dual office, right? It's constitutional. And I just need to say it because it's constitutional. It exists. Article 2, Section 5A of the Florida Constitution prohibits dual office holdings, which prohibit members from holding an elected public office or holding an office in or serving as an agent for a political party. I mentioned that because I have had various board members who, Rochelle, I'm going to run for school board. Rochelle, I'm going to do this. Rochelle, I'm going to do that. And I take them to that section because you need to do everything that your amazing self can do, right? That's the purpose of all of this. We need as many amazing bodies out there doing amazing things. So, but I just bring us to please understand that we have this constitutional restriction. And if it falls in those categories, that would be prohibited. I don't know if you're going to win, so go run. I want you to win, but if you win, you might have to relinquish this position. And so you don't think that you can just, well, I'm on this, I'm going to do this. I'm not saying it doesn't happen. I'm just identifying with the Constitution required. I don't know others who may have dual office holdings, right? But I have to at least identify. I'm a rule of law person. Just always keep that in mind. I'm going to make that part of it now. So with regard to that, if there's ever a question, because if it comes up, and someone outside of this amazing commission were to say something, then that's going to be their basis for having something to say about me, right? So again, my job is, there's nothing to be said about any of the commissioners here. We are doing exactly what we need to do the way we need to do it. So I'll say that I'm not going to belabor it. If you have any questions, I'll take them. I added antitrust onto this, but I don't think we're in a competitive marketplace environment that I need to really bring that out. My antitrust, the Office of the Attorney General has an entire section committed to antitrust areas where you don't want to find yourself in a position, and it wouldn't be this commission, it would be maybe in some other local governing entities with being in a marketplace where they are creating an anti-competitive environment. Because competition is embraced. Anti-competitiveness is problematic. So I think that's the easiest way to say that. But Florida is proudly a state that embraces government in the sunshine, public meetings, the availability of our appointees and constituents is something that I think makes this state as great as it is. I visited other national, because I travel with other organizations and I attend their national conventions, and I'm surprised that some meetings are not public. Some records they don't have to share. Well, that is not Florida. It is not Florida. So if you have any questions, I will be more than welcome to entertain them during this setting. Shortly after this meeting, within the next week or so, when I get everyone's information, I will make sure you're not home. I have my office number, my direct dial. You will have my cell phone number. You will have every possible way to reach me because I want to be available to each of you at any time you need me. It's midnight. I will stop you there. Thank you all for your time. That's it.
Thank you very much. So any questions? All right, so the next order of business then is, which I actually want to call it TD 101. So we're calling it TD 101 and staff introductions. So our next presentation will be an overview of the Transportation Disadvantage Program. Executive Director David Darm will provide the presentation. David?
Thank you, Madam Chair. So this one's the fun presentation. We're going to cover kind of a high-level overview of our program, the responsibilities of this board, and then our partners at the local level. Just so you all know, there will be a quiz at the end of this presentation. Just kidding. Just kidding. Just make sure everyone's awake. We do have the slides in the packet. We'll be presenting them up here on the screen, but this is really just to introduce you all to the program. We won't be able to probably get through all the details, but we also do have subsequent information in here that I'll try to refer you to. And just like what Rochelle was saying in her previous presentation, we're here as staff to help. We can certainly walk you through more detailed information on the 101, but this is really to kind of just give you the lay of the land of our program. Just before I get into the content, I want to introduce myself for those of you who don't know me. In terms of my role here as executive director, I was introduced to this program similar to Commissioner Barrios, being a user of the service. I am legally blind, so I say that I cannot see very far. It puts me at a disadvantage when it comes to being able for transportation, but it puts me at an advantage when it comes to public speaking because I cannot see facial expressions. So if I lose anybody, you'll have to let me know because I won't notice for facial expressions. So I came across this program back in 2009, recently graduated from college, and I was very interested in public policy. And I had just sort of on my side, just as more of a passion, being an advocate of being a voice for people like myself. And I did not necessarily see these converge, this policy and advocacy side of things. And so this program I was introduced to as being in Commissioner Barrios' position. I was appointed in her role from 2009 to 2016. And I fell in love with this program. I fell in love with this industry. I feel like that even though, yes, it's great to have a paycheck, this is really coming from a place of personal passion of mine to advocate for helping improve these services. And I think that's kind of something to start on a personal note in this presentation is that I think each of you all bring different perspectives. We have state agency folks who come in from the government background, which is very vital because we deal with a lot of, systems and trying to work through those systems. It can't just be, something that just flips a switch. There's obviously a lot of collaboration involved, but we also have private sector perspectives. And some of you who are in the private sector also came from the government sector. So it's interesting to see these merge. But I think the goal is at the end of the day, we represent the state, not just a county, but a statewide perspective of individuals who depend upon these services to get to work, to get to healthcare, getting to grocery shopping. You don't think about if you drive, you usually don't think about how am I going to get to work versus how am I going to get to the doctor's office. Maybe you might be thinking about how am I going to avoid the traffic and the congestion and which routes I'm going to take, but you don't necessarily think, am I going to be able to make the appointment for medical versus the 8 o'clock in the morning at work. whereas most of our population has to consider varying types of ways of getting to where they need to go. So our program just tries to meet the gaps where the services or those transportation needs are not being met. So I'll go into the next slide to kind of give you, starting with the customer perspective and then working backwards into the system. The Transportation Disadvantage Program serves sort of you call subgroups or populations within basically 4 groups of individuals. Individuals with disabilities, that could be a physical disability, that could be an intellectual or developmental disability, could be a mental health disorder. We do have some veterans that we serve, but basically that disability has to prevent them from being able to drive, and they're dependent upon others to be able to access important activities in their community. We also serve older adults, seniors who are similar to disability, but their age is contributing to why they're not able to drive anymore or depend upon others for their transportation needs. We also serve individuals who live below poverty line, low income, who they may have the physical ability to drive, but their income limits prevent them from being able to purchase their own transportation. So think about it not just in terms of the physical owning of a vehicle, but it could also mean being able to, say, get a taxi, Uber, Lyft, those kinds of things. And then a fourth group that we serve is considered at-risk children. In the definition, that means foster care, typically the foster care system. So these are obviously children who cannot physically drive themselves, but they also lack the family supports to get them to where they need to go. Next slide. So understanding this is kind of a broad population, and keep in mind that, you know, you can have many of these qualifications. You could have a disability and you could be an older adult. So, you know, this is just the broad strokes of what the legislature determined who would be the constituents of this program. And then we also look at where they needed to go and at different activities. So this is one of the, I think, innovations of this program is that we don't just focus on one specific activity, not just healthcare, though that is a large component of it. We also look at workforce development, education, social recreation is very important too. You're thinking about like what is adding to an individual's quality of life, not just that they're getting their healthcare needs met, but what are the other aspects of their living? Now, this can vary from system to system. We'll get into in a few minutes to talk about how some of the local communities may value a specific or prioritize a specific activity like healthcare, dialysis appointments that tend to be a large chunk of purpose for our services. But in terms of the foundations of the program, we are trying to accommodate as many varying activities in the community as possible. One other aspect to consider is not just that we try to be all things to all people. There is sort of a flip side of the coin, which is that there's limits to how much funding is available and how much resources are available to support these needs. So our program, you'll hear a lot about the word coordination, which is designed to understand where are these needs in the community. So say an individual lives in a large urbanized community, they may have access to what's called fixed route public transit, your traditional, routes, bus stops that are scheduled or at a specific fixed time. So maybe somebody might have the ability to access that to go to work if it's within their urbanized area, but they may not have that necessarily ability to go, say, to a doctor's appointment that's outside of that area that requires a further distance than what the fixed route can offer. Another example of this is Medicaid. We have a lot of individuals, especially those either by disability qualification or by income qualification, that fall in the Medicaid program. They may have access to a doctor's appointment through their state plan, Medicaid state plan, but that same Medicaid program may not necessarily fund their trips to go to work or go to the grocery, or at least historically may not have been able to support them going to the grocery store, which was kind of related because they would need that to go fill out their prescription possibly. So I like to kind of use the analogy that our program, think of it like, if for those of you who are in the insurance industry, think of us like the Aflac of transportation insurance. We supplement or meet the needs where they're not necessarily being met by another program, by another system. So, does that resonate?
Yeah.
I actually did not know what AFLAC was until I was told that was the best analogy to describe our program. So I've been using it ever since. Okay, so next slide. Getting into the history of our program, this program was established in 1979 with an understanding that kind of what I just sort of alluded to earlier was that there were programs that were supporting some form of transportation. These programs, largely human service, health and human service type agencies, were not coordinating their funding or their service providers to collectively meet the needs of this population. Vice versa, there was also, on the other side of it, there were maybe some transportation systems in place in these large urban metropolitan communities, but they were not statewide represented like in the more rural or small urban communities. So as a result, the legislature created Chapter 427 that Rochelle had alluded to earlier, that it was the foundation of our program. And I believe we have in the if I'm not mistaken, there is the preamble to the statute that I'll have to find it, and I'll tell you which page it is in a few minutes, but the preamble basically the statute our program, here's why our program exists. To meet these needs, identify these sections of the population that were not getting their needs met, and there was a need for a statewide coordination of these programs and systems to as a whole try to improve meeting these needs to get people access to critical activities in their community. So that was the foundation in 79. And then over the course of several decades, the legislature kept building, and to this day even is continuing to build the objectives of this program and defining how it achieves that mission. And it all really, a lot of it culminated in 1989 with the creation of this organization, the commission. So it established us in Chapter 427 and also established a dedicated trust fund. Now, for those of you who are familiar with working in the legislative process, especially if you've had to work the budget process, you know that general revenue tends to be a challenge because there are a lot of different programs and a lot of different interests that are competing for those dollars. We are extremely blessed as a state agency, state government program, that we have a dedicated trust fund that supports the needs of, going back to that AFLAC analogy, of those services that are not, we use the term not sponsored, meaning they're not insured by another program. So the legislature was very forward thinking in making sure that this funding would be consistent through the years and has maintained that consistency since 1989. So I'll get into a minute about how the trust fund worked, but that's kind of the foundation of it. We also saw establishing a provider network called Community Transportation Coordinators, or the acronym CTC. I'll get into a little bit about that when we get into the local side of things, but the legislature was basically doing these building blocks to where we are today. Okay, next slide. So I'll stop here for a second. If there are any questions about the foundation, the history, I'll try to keep it so I'm not doing all the talking if there's any questions before we get into the more specifics of where we are today. Okay. So going into our program overview, we are, as mentioned, a state agency. We are housed within the Florida Department of Transportation, FDOT. So we as staff are DOT employees. However, the statute specifically states that we function independently when it comes to policy making from the department. We're basically administratively housed, but we have our own rulemaking. We set our own policies. And as board members, being that you all are appointed by the governor, we directly report to the governor's office in terms of our hierarchy. As we've discussed earlier, the commission board membership has evolved. Right now, we are at 11 members, which was just changed this year. Ken can tell you from the history that board membership was once upon a time up to about 27 members at its largest, which had varying industries directly represented. When I came in, it turned from 27 to 7. It just shifted over. And so went from a bunch of interests of people who had direct stakes into the program. I mean, all the different private sector interests, advocacy interests, to where it was the legislature went the other way, the other direction, to say we don't want to have any interest groups that are directly impacted by this program to be on the board, which was good intention, but also challenging because you had people who were coming in these decision-making roles who weren't really familiar. And so really, as far as staff goes, we had to do a lot more legwork, I think, in terms of educating our board members and getting them to understand that this is very, there's a lot of nuance to this system. So I think now we're at the kind of that median where we now have some specific stakeholders represented, like the state agencies recently became voting members again, whereas before they were not. So it's brought in folks like Commissioner Hatch at her level, the higher level of decision makers at these agencies. And then we have specific industries now represented, as well as the county level perspective too, with Commissioner Micah's role. So I'd say we're kind of in that balance now between having interests directly impacted, but still not necessarily direct financially tied to the program. Some other responsibilities as commissioners you will be seeing is one that will be coming up soon is appointment of the executive director, which is my role. And then my position is to oversee the team. So we have a staff of about 13, I think, full-time positions here in this building, actually. Some other responsibilities we'll get into a little bit more is about the roles of the CTCs, the Community Transportation Coordinators. You all get to vote on the designation of that entity that serves in that role at each county level. So we will have next month a discussion of the annual performance report. So in Chapter 427, we're as an organization are required, like many other state agencies, to put together an annual report. The governor and the legislature basically summarizes all the activities of our system that are being reported through the CTC network. And so that data is collected from the CTCs, the performance data from a previous fiscal year. We as staff compile that into a report and then submit that to you all to vote on and approve in the December commission meeting. That's due on January 1st this year, each year. So one other big important item I'll get into in a few slides here more in detail is our grant programs. I'd say this is probably the biggest content learning curve for a lot of folks to understand how our funding works. We have 2 grant programs specifically that we've come up often, especially during the summer when we are reaching the end of the fiscal year, when it comes to approving the grant funding for various projects, whether it's for a competitive service project through the Innovative Service Development Grant or capital equipment purchases. So that would be vehicles and technology needs. And I'll get into that as far as how those programs work. But you will see usually in June decisions around that, about approving those funding for those projects that are funded under the grant programs. So that's kind of an overview. I mean, I'd say not just thinking of your role though as far as the actual action items to take, but also engaging our systems and learning. We have these meetings, we have public comments, so we get to hear from the field. We have usually an annual day at the Capitol during the legislative session, so we do encourage folks to come to that because then you get to hear about what is going on during the legislative process. We also have usually a conference, training conference for our providers, our stakeholders, but we do try to encourage our commissioners if they can to make those meetings because that gives you a chance to engage and learn about what are some of the challenges going on in the field. And so those are just some additional activities to consider in your role as board members. Okay, next slide. Getting into the trust fund. So most of the funding is earmarked or identified that have been over the years by the legislature. The largest chunk of the revenues come from the license tags when you register your vehicle as a Florida resident. Portion of proceeds, $1.50, I think it is, goes to directly to our trust fund. FYI, if you notice when you go in to register for your vehicle, you also have an option to provide a voluntary additional dollar or more to the TD Trust Fund. So if you are so inclined to add additional revenue, those dollars, by the way, for that voluntary dollar can go back to your direct county that you registered your vehicle. So those are dollars that are going actually straight back to the services in that county. There's not very much that comes out of that, but it is something worth noting. The rest of the revenues largely come from DOT side of dollars that have been directed by the legislature to go to our trust. So think of our trust fund, for those of you who are not necessarily as familiar with the legislative budget side of things. Trust funds like the bank account. The legislature acts like the bank that gives us the authority to spend the dollars. So we get revenues that come in, that trickle in through, especially through the license tag renewals throughout the year. And we will monitor, just like the Revenue Estimating Conference has their process of monitoring throughout the year, the revenues that are coming in. But ultimately, we don't have the authority to spend those dollars without the legislature setting that amount in the budget, which is the General Appropriations Act, or GAA. So each year, we've had a few times, we've had some challenges where, even though we might have revenues that show, say we have like, just picking a number, like 65 million in revenues for the year, the legislature may choose to only give us 60 million to spend for our grant programs. And so even if we have an additional 5 million sitting in the trust fund, we cannot spend that without the legislature giving us that authority. So the next slide, once the revenues come in, and that is funding all of our services, as far as especially for the grant programs, we distribute those dollars based on what the legislature sets in the Appropriations Act through 4 specific grant programs. Now, in the packet, if you're looking at your PDF, it's page 25, gives you more specific details about each of these grant programs. I'm going to try only to cover the high level stuff. But if you want to know more about it, that information and subsequent information in this packet is available for you to learn the details. The biggest grant program is our Trip and Equipment Grant. That is a formula-based, kind of like a block grant that goes through a formula that's established in our rule that goes to all 67 counties to support the delivery of we call non-sponsored transportation disadvantaged services. Non-sponsored means those that are not funded or reimbursed by another state or federal or local program. So, for example, Medicaid is considered a sponsored agency when it comes to folks on Medicaid who are getting trips to the doctor's office. Non-sponsored could be, in theory, a trip going to the for that same Medicaid client to go to work with that's not being covered by Medicaid or another agency. So the Trip and Equipment Grant distributes, basically allocates each, go through a fiscal year cycle. So July 1 through June 30th, it gives basically an allocated total amount for each of those counties that they can spend up to that amount on delivering services for this non-sponsored transportation disadvantaged services. Important to note is that just because a county gets an allocated dollar amount, so let's just say for the sake of argument that Miami-Dade County gets $5 million through their Trip and Equipment Grant. That doesn't mean that all of a sudden now they have that money that they can just spend. They have to actually deliver the service. We do it through a month-to-month reimbursement cycle. So they have to invoice us, the provider of Miami-Dade County, the community transportation coordinator, has to invoice us for the trips that they provide or the bus passes that they purchased. And we review that data. So we have to verify that there were, a date that a trip was made or pass was issued, and we have to see a name of a person served or something to that effect that verifies these services did in fact be delivered before they actually get reimbursed, paid for those services. So why that's important is because you may have systems by the end of the year that don't get to draw down or spend all those dollars by the end of the fiscal year. Many of you know, corporations know when you don't spend it, it goes back to the trust fund, and then it comes back around for the legislature to choose how to reappropriate that in a future year. So that's kind of an overview of the biggest program. One thing I also want to mention there is the formula is that we just recently, 3 years ago, implemented a new formula there. We can provide you with the study that supported that decision. But in essence, that commission, this organization approved a new formula that considers 4 variables in a real simple terms. One is actually 2 of the variables are considered demand-based variables. So considering the eligible transportation disadvantaged population. So those are people with disabilities, those living below poverty, and seniors 65 and older based on the census data. So that's 5% of the funding that basically considers each of the county's estimated TD population. The other variable is considering the miles of public roads that are in that county. So the distance that they have to travel to be able to deliver service. And then 30% of the funding is based on a prior year performance. So how much did the county actually deliver in services from a previous year? So considering both not just the demand for services, but the performance of the provider delivering those services. And then the remaining of the funds, the 4th variable, is a base variable. That's basically stability funding. So we've had in the past years where you have counties that would have wild swings in their funding, whether wild up or wild down. And so this base variable is trying to bring a little bit more balance so that the performance doesn't, cause major disruptions of service. But over the period of time, if the system's seeing decreases, whether because of population change or because of performance levels, those should be gradually year to year, not immediately in 1 year change. So that's kind of an overview of the trip and equipment grant. That's the biggest grant, and that's one I wanted to spend more time on. The planning grant is more specific to our planning agencies to support basically doing activities like what we do as staff, they do at the local level to support their local transportation disadvantage program. And then the other 2 grants are competitive grants, the ones you will see as decisions for the commission board. One is called the Shirley Conroy Grant that is focused on capital equipment purchases. By competitive, I mean that the CTC has to apply for the grant, basically make a need that they have, purchase a new vehicle. Maybe their fleet is getting old and they need to purchase a new vehicle to support the services, or it could be a technology need. It could be cameras on a vehicle. So it will just depend on what system is applying for their specific local service. And then finally, the Innovative Service Development Grant, ISD is the acronym. That grant is the newest program that we have been administering, I'd say now 8 years. That program has kind of experienced some wild shifts in terms of its funding and in terms of its objectives. But in a nutshell, in essence, what it is designed to do is to test, pilot new services in a community where there may not necessarily be, say, for example, they may not, a CTC may want to try doing an on-demand service that they cannot do right now. You say your traditional call in advance 24 hours or something like that. They want to say, let's try doing a same day type of trip. This would be a competitive grant that could be potentially something they could apply for. And you as a commission board decide whether or not to approve that project based on what is available, what the legislature deems for those projects. But in essence, it's designed to either test a new service, maybe serving an underserved population. It could be serving also a cross-county need or regional need. We do hear that a lot often historically, that a lot of our systems are county-based. And so this could be a project that they could try to expand their services. Also, it could be testing how to increase access to, say, fixed route services if that is existing in their community. So we have, for example, a project that we just wrapped up in Pinellas County that was funded for that through that grant program that was serving individuals who were working late shift hours. Because Pinellas County is St. Pete, you have a lot of tourism, hospitality industry. So TD workers could be going to work using the fixed route, but not necessarily they're working at 2 a.m. or so. They don't have that fixed route service available to them after hours. That was a project that could help them get their trips back home. So that's just kind of a summary of an example of what could be funded under that project. Are there any questions about our grant program? Again, more information's in the packet. But I'll get into the local side for that, but is there any on our grant or our statewide activities?
Go first. Really just a comment. Thank you for the overview. Very informative. Did have the opportunity to visit through the commission. Obviously, this past summer, we were distributing funds in a lot of these buckets. And what we discussed and what was lifted is the Innovation Service Development Grant, if that all the words right, is so important. And it is supposed to, I think initially was the intention, it sounds like, act as almost seed money to pilot. But we've seen some really great nuggets and models come out of that ability to spur through funding. And so I think that what I'm interested in is then what's next for those entities, right? Because you have the ISD grant and then the trip and equipment grant. We want to push both of those to deliver and have providers that essentially provide services that would be good enough for your own loved one, right? They're meeting and filling in the gaps where those exist, like you mentioned, in the evenings, perhaps. And so the third quartile that you touched upon, the trip and equipment grant, I think classes, was around performance. But I think that it's worth having a conversation about pushing that beyond just utilization to true performance and effectiveness. Understanding that grant and the formula was recently reviewed 3 years ago, and it's within Rule 2. I guess the question here is, what would you recommend if the commission was looking at trying to, again, establish a more competitive environment, fund for performance like we've discussed previously? When would we need to start that work, knowing that we need to potentially look at a formula, update a rule, and be prepared for the following June?
I'm going to try to answer, but I may not understand fully the question. I think there's two different questions I'm hearing from that. So there's the side of what's on the trip and equipment grant, how that works, versus the Innovative Service Development Grant, which is a temporary funding. So the trip and equipment grant, that formula, if you were to want to, as a board, revisit that formula, you would open up your rule. And Rochelle and I worked really closely together when we went through that process to examine how the percentages are divvied out. The challenge is kind of connecting it with the Innovative Service Development Grant. If there's no funding, remember I mentioned, like I said, that the system may not necessarily spend all their dollars. So if a system has money left over in their trip and equipment grant, in theory, they could, if the ISD grant, the pilot grant, basically, if that project showed, hey, it was working, we tested it, there's a demand for it, we have a way to manage the demand for it. In theory, they could, with the commission's, blessing, fund some of those trips, continue that project under the trip and equipment grant. The challenge is that what if they don't have dollars? So we have, say, a project, I'll use a specific example, Indian River County, St. Lucie County. They're being funded projects serving individuals with developmental disabilities going to work. That project has been very popular. That's the highest funding project. I think it's up to 1.2 million right now. This is I forgot to mention that it's a 4-year limitation on how many years a project could be funded under the ISD grant. So this year, Indian River to St. Lucy's project expired. So it will be up to the CTCs in those areas to work, figuring out how are they gonna fund those services if they want to continue those services. And I don't think their trip and equipment grant dollars could be supporting a large chunk of those trips, being it's, 1.2 million right now. So I don't know. I think that's going to be something of collaboration. The staff can attest, this has been a real challenge. I'd say this is probably one of your biggest challenges as a board, to figure out what kinds of guidance could we provide CTCs that have demonstrated that their innovative service development grant projects that have a meta need. How do they continue those? Because you know how it goes when you pull something from that, especially people relying on those services to go to work or go to doctor's offices, there's going to be a backlash, a shock to the system. So that's been something we have struggled as a whole, as a state, to figure out how to make those projects sustainable. I think is the word we use, sustainability. So was there anything, I want to be sure, Carrie and Karen, was there something I missed on the ISD side?
I think, just to clarify, what I think the commissioner here is asking is timing on how you would adjust this calculation in order to incentivize a movement of potential things within the ISD grant
Calendar.
effective, and how you would then move funding towards it. So what is the timing look like on when you would need to do that? I think is that correct?
Yeah, like how long did it take last year or 3 years ago when you were looking at the formula, then you had to update the rule?
Oh, I see.
It's the sequencing of that.
For our rulemaking, we were in kind of a directive by the legislature to do that. In that case, and for that formula, I think it took us we had a contract with Thomas L. Ferguson, one of our consultants, to do the study. I think that took about 6 months or so between public workshops, that sort of thing. But then you also have to go through, if you're going to change the rule, Rochelle would have to guide you through a rulemaking process. And depending on how substantive changes you want to make, you may have to have at least a few months planned.
The rulemaking depends on your audience. Honestly, it can take as little as, they say 90 days is a ballpark. But when you open something up that is going to have some monetary impact, you have a lot of stakeholders that may have a lot to say. They may want rule hearings. They may want to discuss how this change is going to impact them and why are you doing it. I think for this, we may have had workshops or something where we can discuss it, and everyone was not happy. So if you add that in, it could take a few months. I mean, what I will note though, that if you open a rule up for the government, it's to be completed within 12 months. If not in 12 months, that rule will expire. So even you start.
Yeah.
So we sometimes have to toll rules. So, but if things go as they should, it should happen within 90 days. But some of this information does not allow for things to go as they should, because folk have a lot.
So it's the rulemaking process that you would need to go through.
Or to change a rule, you need to go through the rulemaking process, which you would have to include your public.
When are these funding allocations decided? Like what time of year does that?
So we go through the legislative process. So this year, in the spring to March and April, we monitor whatever is set in the appropriation. Then we work it backwards. So the legislature usually gives us a total amount that goes to what's called our grants and aid category. And then they may specifically state what some of those dollars should be used for in their proviso. So for the ISD grant, they specified this current fiscal year we're in, that 3 million would go through the ISD grant for the objectives that are basically outlined that we discussed. And then for the rest of the dollars, Elmer, we'll get into introductions in a minute, but go ahead and introduce Elmer as our budget director. So he will do the calculations based on how much in our rule is divvied out, because we have like 1.7 million that is put aside in the rule for the planning grant. 1.4 million is divvied out for the Shirley Conroy, and whatever is left over goes to the trip and equipment.
Those two are governed in statute presently.
The rule, all the grants.
the allocation of NRL.
That's right.
Okay.
So you don't have to go through a legislative process per se, but you would have to go through the rulemaking, and whatever. If you're trying to, well, in our case, we were trying to create a new formula or examine a way of doing a new formula. So that took an additional amount of time. If you were just simply wanting to adjust, say, the percentages, I don't know if this is where your question was, Commissioner Hatch, but like, say you wanted to add more or take away more percentage of performance, you could, in theory, just open up the rule and discuss it, just adjust the numbers. We did design this formula with that allowance that you could shift that, but you would have to still go through the 90 days or so rulemaking process. So
Quick follow-up question. Thank you for that. The ISD grant, is that the policies around that grant? Is that also in rule?
for the most part, we as a board have made policy decisions without necessarily going through rulemaking. And one of those decisions was the 4 days, sorry, 4 years, excuse me, limit. That was a decision made by the commission by vote, but it was not necessarily put in to say that it should be limited to 4 years. So we did change, I think, the rule, or update the rule language based on the current practice, but we didn't necessarily add the 4-year limit in that.
So, and you kind of hit, Sharon Hatch, on like my thought process, obviously new to this board, not new to providing transportation services to vulnerable populations. And when you said you had some additional information on a study on how the formula was created, I think sharing that would probably be helpful. Give us a little bit more information on some of the breakdowns and the decision making around it. Obviously we want to drive quality, right? And getting a better understanding, for me on the 30%, just purely based on prior year performance, what does that mean? Is it performance driven? Is it check the box? Is it, what does that look like? And then my other question, again, similar to Commissioner Hatch, was what's the uptick, right? If we are funding these innovation grants and they're driving great outcomes and high quality performance and serving the population as being just innovative, how do they then transfer into that formula-based program, right? What's that pathway to continued funding if we're seeing better outcomes? And it sounds like we may have some further discussions that are needed on that.
I'll be happy to send you all the study that was done that led to what you have in rule now. But basically, to the performance side, it's based on the trips, the miles, and the bus passes that are directly reimbursed through the grant program. And that's data that we collect as an organization from when we're paying them their invoice. So it is not including, by the way, any outside of that. It is just what the grant program directly is reimbursing.
Have any of the programs that were funded through the Innovative Service Development Grant been moved into the trip and equipment grant process formula?
I don't know if we,
Not into the formula,
none of the four.
but the services have been incorporated, have been covered by the trip and equipment grant.
And if I remember correctly, there have been programs that individual communities have found funding for, like through the county or so on, to moving forward. And the discussion prior was in the future, when folks applied for these funds, to have part of the application to show their plan to make sure that it was sustainable in the future if the project was successful.
Was there any, within that study, was there any consideration to client satisfaction or client feedback?
No, not specifically like surveys or quality assurance side of things. No, not it. We were working based on what we had data available to us to be able to come up with a calculated logic form of the formula.
Okay.
I'm using utilization, right? Because the customers like the program, then they're going to use it.
Well, utilization being the direct reimbursements of the grant, but not necessarily whether they thought the service was high quality it was more just the direct utilization of that a person's name, time and date, and all those things were verified that that person was getting reimbursement.
It may not be your formula, but, and correct me if I'm wrong, part of the reporting at the end, they have to do a customer satisfaction survey. So we do have insight as to how satisfied the customers are, even if they weren't as the formula, they were calculating that. So there is a basis there.
And that was part of the study?
Not part,
Not the formula.
not part of the formula.
That's for the-
Insight into customer satisfaction.
Through the, just the one.
The competitive, the ISE.
If I may, Director Dunn, there are two things. We, as a commission, would always, you're gonna hear me use mindful a lot, but I just feel with it. Not confusing rulemaking with policy and being careful not to have policies in place that rules can't sustain because that can be considered non-rulemaking. So it can get sticky. So things that we would just have to keep our eyes on. And what may also be helpful to the commissioners is not only giving a history or some documents of how this calculation was actually derived, but those webinars, you can't please everyone, right? So you're gonna hear the different groups or individuals who had problems with the way this formula ended up being. And that might be helpful in understanding and thinking about if you're gonna make any changes, what considerations you want to give any credence to moving forward. So having all of it available might be helpful.
I hope that helped in clarifying, not making it more confusing. Are there any other questions on the grant programs?
Thank you for your diligence.
No, that's good. That's what we wanted this today to be, is more understanding and getting into the details. Okay, so the next few slides, I'm just going to go through briefly, just an overview at the local level now, how our program works. So in the past, we've sort of described it as, think of our role as board, centralized policy development, but decentralized local implementation. And there are three entities that are responsible for the implementation part at the local level. They're the planning agency, or designated official planning agency is the full title in Chapter 427, the local coordinating board, and the community transportation coordinator. So I'll go through each one. The planning agency, again, kind of think of them as like an extension of us as a staff at the local level. You could be an MPO, Metropolitan Planning Organization, a transportation planning organization, or something similar of that. We as an organization designate who that entity is. That's usually not something that the board sees as much on decision making, but these are sort of like historically established organizations that play that role. Their primary focus, I'd say, is to look at whatever planning activities they do as part of urban development or designing of services, considering population growth, that the transportation disadvantaged population is considered within those activities. So, how are you, we can say in the state of Florida, one example would be, considering your senior population. We've seen a growth in that population as the nation's growth of aging populations growing. So the planning agency is trying to consider that constituency group. How are they being woven into the community planning of services, especially as it relates to the paratransit, public transit type services that we fund or our system fund. They also play a role like us as a staff, the local coordinating board, which I'll get to in a minute what that role is, but they do a lot of the quarterly meetings, setting the agenda, appointing the members to those local coordinating board members. So unlike the governor's role, I guess they kind of play it like that's sort of like both the governor's role and the staffing role. They both staff the board and they appoint the members, recruit the members to serve in their respective roles there. So very, very brief summary kind of about what the planning grant does, the planning agencies do to support the local side of things. The next slide then gets into more about what the local coordinating board role is. And then basically, these are your stakeholders represented. This is their chance to weigh in on the services or the challenges, the unmet need. They represent, like yourselves, individual writers, advocates, families that are impacted by these services, the business community, transportation industry, healthcare industry, workforce development, a pretty wide array. And I believe that all those roles are established in our rule. It's in statute and rule, but the rule specifically identifies the types of industries and organizations represented on this board. They are chaired by an elected official. So it could be a county commission, commissioner, mayor, depending on which community wants to designate that person in that role. But they basically meet quarterly. They identify what some of the areas of need. They engage the CTC about their services. They have at least once a year a public workshop, which invites members of the public to talk about the services if they wish to. And then they approve major action items that are impacting their local services. So one of those examples could be in 427, it allows for a lot of local autonomy in how they prioritize their services. So I'll give an example. Martin County is a county local coordinating board that has decided to divide their funding in half, where 50% of it, the maximum of 50% of it can go to medical, so dialysis type trips. But the other 50% needs to be for other purposes, because some of the systems may say that if we just did all medical and allowed for that, then there wouldn't be any dollars left to support other needs of the community. That was a choice that LCB, local coordinating board, decided for that specific county, but it can vary from community to community how those services are prioritized or funding is prioritized. And then finally, the CTC, Community Transportation Coordinator, they are the entity that we designate to be responsible for either delivering the services directly, those paratransit door-to-door services directly, or contract those services out with another provider. It just depends on what works best in their community and based on the service operations model. So these entities could be a county government, like Commissioner Mike's area is that's an example of a county commission, board of county commissioners that are overseeing the program. It could be a transit agency, a public transportation provider. It also could be a not-for-profit, like a council on aging or an ARC that could be doing those services. The process that goes for a CTC or an entity to serve in that role is through a procurement process. We have, as an organization, have delegated that responsibility to the planning agency to facilitate a procurement, basically do a bid. If it's a county government now, they can waive that process, not compete for it. But if it's a private, for-profit or not-for-profit, they have to bid for that role. And then the planning agency determines and recommends basically to the commission who should serve in that role. But ultimately, it's the commission's decision as to approve that or not. Many of these organizations have been historically there, but we have from time to time shifts. Usually it's designed to be a 5-year contract, but we've had a few occasions where a provider will say, we don't want to continue doing the service anymore. We just had one recently in Nassau County where they will have to come up to the commission and say, we need somebody to designate by such a date to serve in that role. But was there, looking to team, is there anything on the three entities that are at the local level overview that commissioners need to know about that I missed?
Oh, you said them all.
So I only have a couple more slides left real quick, and then we can have a general discussion. One is the.
Sorry, can I
Oh, go ahead.
ask a question?
Sure.
You said that a county government can waive the procurement and just give a contract? Is that what you meant, or did I
You
miss?
want to explain that process?
If a county government, if a governmental entity is providing the services, it can be exempt from the competitive procurement
Okay.
process.
Okay.
So that's why a lot of the county governments are the PTC.
Got it. Okay.
And I think that's a general chapter 287, right? That's established in that, but it's not unique to us. That's a sort of a standard practice of governmental entities. So this slide gives a, I'm sorry, was that
Yes,
any other question?
Thank you.
This slide gives an overview of just the general, basically our outcomes, our services, which are kind of covered as, most of them being paratransit door to door. These are traditionally done in your small buses that are called cutaway vehicles. They're scheduled between the rider and the CTC. But we also have some CTCs that have fixed route bus transit systems where an individual demonstrates they have the ability to access it, physical ability to use those services. But they may have a financial burden that requires them to get some subsidy on that. So you have a few systems that are using our dollars for bus passes. That tends to be more cost effective, by the way. You will hear likely down the road. The challenges with paratransit is that they are more costly. And they can be challenging when you have constantly trying to meet those demands, meeting door-to-door services. So if there is the ability to use a fixed route system, tends to be the more cost-effective option to purchase a bus pass fare, basically, versus a paratransit door-to-door service. The other two are the capital equipment. So that's the purchasing of vehicles, technology, which they could use their trip and equipment dollars, not to mention up to 25% of that grant allocation could be used for the purchase of capital equipment, but it's rarely done. It's very, very few occasions when we have that. It's just an available option if they so need it. And then, of course, the planning activities that the planning agencies do are funded in the 1.7 million planning grant. That's one of the outcomes also. So then last slide here, next one is, oh, no, I'm sorry, two more slides. So this, I'm sorry, Debbie, back one more. I got ahead of myself. So this is something for y'all to know going into next month. In the next coming weeks, we will be putting together, sending you all the annual performance report. So I think that's going to be new with the exception of Commissioner Barrios, Commissioner Tellez. I think everybody in this room is going to be new to this process. So I want to just spend a few minutes here to explain this. So as I mentioned earlier, in chapter 427, we're required to put this report together to give it to the governor and the legislature. The process that leads up to that point, there are two data sources that we use to basically report what our organization or our system is supporting. One is a macro level system-wide overview through what's called the annual operating report, AOR. And we did have a study recently on this. So just a summary of what this does. This is considered basically your total trips, total passenger served that is reported by the CTC. This is all across programs, not just what the TD Trust Fund is paying for, but if there's local government dollars being supporting services, if it's fixed route, so what fixed route systems are supporting PD riders in their community. We have a third-party entity that maybe the CTC doesn't directly work with, but they do collect data from is what's called coordination contractors, which is a fancy technical term for, say, to be more specific, like APD may contract with an ARC to do trips for specific people to go to adult day training programs or residential facilities. Those providers may report their trips that they're providing, which is considered a segment of the TD population, that the CTC will gather and put it into this annual operating report. So just think of it kind of like a system-wide aggregated snapshot of what trips were occurring across the county for the previous state fiscal year. The other data source is directly from our grant programs, specifically the trip and equipment grant that we were funding under the TD Trust Fund. So those are your passengers served, your trips and miles covered. So that gives you more detailed types of data that we can run more specific analysis on about what our program performance is. So those are collected together, put into their annual performance report, and then we send that to you all as a commission to discuss and approve before the January 1 deadline. So, and the next slide just gives you an example of what that data looks like on the trip and equipment side. That's a snapshot of what total trips we funded, paratransit trips specifically, we funded under the trip and equipment grant over the last 4 years. You can see that has gone up because I'm sure that you all remembered an event that happened in 2020, causing a lot of challenges across our industries. That was the pandemic year. So we did have a decrease in trips, but each year subsequent from that, we have seen an increase. In fact, I think this year we've exceeded what our previous pre-COVID numbers were. But this is an example of the data that we have collected and reported into the APR, annual performance report. So I appreciate y'all's time. I know this is a lot of information, but I felt like we wanted to spend a little extra time on this because this is going to give you an orientation about what you're going to be seeing in the next coming months. Is there any questions about this or anything else that we might not have covered as far as your roles as commissioners?
Thank you very much. So we will now introduce the members of the commission staff and their roles in supporting our program.
Start.
Karen Somerset, I'm Assistant Executive Director, been with the TV program since 1986. David was talking about it being a commission. I was with it when it was a coordinating council under DOT. So I've seen it grow throughout the years. And currently David's right hand, but I also oversee the project manager statewide.
My name is Sherry Powers. I've been with the commission since 2008. I am a project manager and I handle the counties, probably Southwest Florida, kind of into central, a little bit Polk and some rural areas of DeSoto, Hardy Highlands, Okeechobee, but cover urban and rural. And I guess one of the leads on the ISB grant and the Shirley Commons.
I'm John Urban. I'm a project manager for them. I serve I'm responsible for the southernmost counties of Florida. And this next year will be my 30th year with the commission.
I'm Cecile Del Morel, and I am also a project manager. I do work in the Panhandle, west of Wakulla. I do have 3 urban areas, and the rest are rural.
All right.
Dave?
I'm Debbie Hall. I'm the IT manager for the office, and my role is basically the web maintenance, website maintenance, any setup in there, any changes, so forth and so on. And I also do technical documentation for the office and any other kind of tech and stuff I can get my hands in.
Hi, everybody. Elmer Melendez, Director of Support Services. I'm over some of the IT aspects, budget, anything that deals with budget, I oversee there. And I've been with the commission for 17 years, not as long as some of my peers, but it's been a while. It's good to meet you.
Hi, I'm Kyle Mills. I'm a project manager, and I'm responsible for Central Florida. I've been with the commission for about 6 years.
Betty Mary, I'm a project manager as well. Been with the commission for about a year. I'm from Department of Management Services, and I'm very excited. And Big Bend area.
Hi, my name is Isabella Morales. I am the data analyst. I've actually only been here since January. But I've learned a lot while I'm here. I'm excited to continue to be able to help people for transportation disadvantaged. It was my dream to work at FDOT. So I'm working where I wanted to.
Just may I add that Isabel is not just the newest member, but also, or one of the newest members, but also her position is new. We just included data analytics part of our team this past year. So this has been bringing data more involved in the day-to-day operation, but not just board meetings. So just wanted to add that.
Here at the Office of Administrative Assistant. I've been with the commission for 2 years now. And I look forward to getting to know all of you.
I don't work for the commission. Will introduce myself. Melissa Kate Matthews, and I'm the manager of FDOT's Public Transit Office in Tallahassee. So I provide you guys in the commission, you know, I love you. I don't need to say it like that. I love you. I would work for. Like our friend. We have 3 other staff that weren't able to join us.
Yeah.
Dan Zarudo, Teresa, Julie, and Julie Cole. Yeah, Cole. James.
Is there a department award, Melissa, for lowest turnover in FDOT? Because I feel like we should be recognized.
I mean, I feel like it made some skew there with a 30 and then a few months here, but
It's like slightly skewed.
Yeah, but fantastic crew that's a part of this one too, and I have to say that as well for the work that I've been able to interact with y'all on this one too. Y'all are a wealth of knowledge and so just caring and thoughtful about what you're doing, what you're working for on that one too. So it is a pleasure every time to be able to interact with y'all. Thank you for that.
Thank you all. So we are at about 2 hours. So do we want to take a 5-minute break or do we want to keep going? Somebody's gonna 5-minute break. 5-minute break. Okay. So we will reconvene at 3 o'clock.
You catch up with the commercial.
It is the 2024 legislative requirements overview. The next two items pertain to legislative changes that occurred this year. Commissioner Melissa Smith from the Florida Department of Transportation will provide an overview of the legislation and its impacts on public transportation and TD services. We will then discuss a specific provision within that legislation that requires action from the commission. Commissioner Smith, floor is yours.
Thank you, Chair. I appreciate that. I will give a brief overview of 2024 legislation that this commission has been implementing over the past few months. So great progress that's been made on that one and bringing up the implementation just in time for a new session to start on this one. But so Senate Bill 1380 included multiple provisions to enhance transportation services for individuals with disabilities and the transportation disadvantage. There is a summary within your meeting packet for those who want to get a more detailed look, but I'll simply hit some highlights about some of those implemented procedures and provisions that came to it. One of those was the CTD membership, which we are all through today as part of that implementation of it, which is great to all be together and see one another and get to hear the new perspectives and the different talents and resources and perspectives that each commissioner is bringing to this table. So I do appreciate that. Look forward to all the great things that are going to continue to build out of the commission for that one, thanks to this. There was also a paratransit driving training requirement that was in there. This is one that's just familiar with because APD was tasked with putting that one together, and that was establishing certain training requirements for paratransit drivers. This was a team effort, I will have to say, so it's been great knowing that we have fantastic staff behind us too that can help support and implement these. So a great work behind the scenes when it comes to APD, FDOT, Cutter, and CTD staff as well, bringing that together to make sure that we could have the best curriculum and the best way to implement that piece of legislation to ensure that our service continues to grow and has a quality and excellence that our customers expect behind that one too. So thank you, everybody, for the work that's come into that one. There's also an adverse incident reporting requirement. That's a part of the legislation as well too. The chair referred to that one as the next item on the agenda for this one too. So I won't go into that one too much detail, but that's another directive that was to create model procedures for receiving and investigating reports of incidents in our transportation services. Those are going to be, we'll look at those next, but those are model procedures that we're asking so that our partners can take those model procedures, they can report those up, they can implement those at that level, and then they are required quarterly afterwards to report to the CTD all adverse incidents. So another way of quality control, another way of monitoring, another way of getting those data points as we're looking at data more thoroughly on this one too, to make sure that we can provide exemplary service as best we can and see where we can fix those. There was also a comprehensive study that was required as part of that, and this is where DOT comes into it. DOT was directed to do a comprehensive report on transportation disadvantaged services. That report is well underway. It is due January 1st. We thank everybody who has helped in gathering that information, pulling in those data points, each of the agencies, each of the locals that have helped us gather that information as part of it. We are coming into a landing on that one as that reporting requirement is coming up quickly, approaching for it. So we'll let you know how that comes about and establish further into it. Happy to come back and provide some updates to this commission as well too, as that goes to it. But that report is due to the governor and the legislature by January 1st. So that's a quick overview of what everybody has been working on and implementing over this past summer. And as we're going into the next session as well too. So just wanted to once again say thank you to everybody. It's been great to be a part of this one too. Luckily, with the commission change that happened as part of that one, I and Commissioner Hatch were lucky enough to be seated on this one thanks to our positions at state agencies at this one too. So we got to jump into it very shortly afterwards and get to know this commission and the work of this commission and how we continue to do that one. So it's been great to see and excited to go home. That's that.
Thank you, Commissioner Smith.
Yes, ma'am.
So as Commissioner Smith stated, SB 1380 requires the commission to establish model procedures for transportation service providers to investigate and report adverse incidents pertaining to paratransit services for persons with disabilities. In consultation with FDOT, CTD staff drafted adverse incident procedures, which are included in the meeting packet on tab 4. David Yarm will provide a brief overview of procedures and discuss next steps. David?
So tab 4, adverse procedures. That's all I know. This is really straightforward. So in essence, the legislature directed us as an organization to approve the word model procedures, meaning that those procedures we're putting it out there for local systems to basically come up with their own procedures. And correct me if I'm wrong, Commissioner Smith, to jump in if I'm misspeaking here. But in essence, we're not going in to necessarily investigate and conduct deep dive into the operations of these services. These are more to assist, guide these local providers in coming up with a process, basically, if they don't have one already, or to modify their process to meet these guidelines. The only obligation really that, as far as it's directed back to us, beyond approving the model procedures that are presented here in tab 4, is that we get quarterly reports back from these providers. And then specifically in the statute, in the first page, it shows you that it's really only 3 provisions of the statute. These are providers that are under contract with a county government or county to do paratransit services for persons with disabilities. So those could be services that we're funding. Or let's say we fund a CTC county government, and they could be in turn subcontracting with a provider to do those paratransit services under our program. They could also fall under more of the federal side, to the fixed route system called the Americans with Disabilities Act, paratransit services, so they could cover different programs. It's not just the ones funded directly in the PD program. But in essence, in this statute here, in the subsection 3, it specifically states that they have to report back quarterly to the commission, basically the status of these adverse incident procedures. So the tab 4 fulfills 2 requirements. One is the established, being proposed to you all to vote, approve these adverse incident procedures. Again, Melissa Smith and her team helped us put this together. Karen did a lot of research on putting this together. We did a workshop. So this is basically just the guidelines that you would be considering to approve. You can either do that today, or if you want to come back in December, you want to just marinate on this. It's not necessarily substantively changing policies or changing business practices. This really just fulfills the legislative requirement. And then the second component of this on the last page is a reporting, the quarterly report piece that's required of these providers to report back to the commission, basically the status of their investigations. So again, it's not changing anything in practice. It is mainly just to fulfill that requirement. I would say that it's probably in the future, we will probably see these reports coming back at some point to the commission board and maybe even in the annual performance report. If the legislature wants to know more details, this would be the vehicle in which they could look at this kind of information. But in essence, it's this bottom line is to fulfill the legislative requirement that was passed SB 1380 pertaining to adverse incidents.
Director Dorn, what is a adverse instance?
Just gonna say,
That's a $1 million question. Commissioner Smith, might I put it to you?
No, not at all.
Because I know we have federal, there's some federal guidance out there or other practices out there.
So there's some of those too, but it's one of those two where these guidelines come into it. So any sort of complaint that comes into it, any sort of way in which there is someone who had an incident or someone who felt as though an incident occurred to them, that they are able to report that. They can report it to the local government, they can report it to the transportation provider, and then that can be looked in further if it needs to be on that one too. In the statute, there was not a given definition for what an adverse incident was. So that is where we're giving the guidance, it proposed on this one too, of over-report as we're starting to do this one too. Anything and everything that come into your call line that you have now set up for it. You guys do have complaint lines, grievance lines set up across it. What this is to do is to provide more of those model policies of what should always be included in those governing policies of it too. And the fact that you would now have to commence an investigation within 48 hours. So it puts a clock on it as well too, across the state for all of those.
procedures that are already out there, or those who haven't created these procedures yet, it provides that guidance of what should be good and a model policy that comes up to.
Does it have any reporting requirements so that I mean, I know we now have interest in data or
Absolutely.
easier access to showcasing data. So does it have a way for this commission to be able to see?
It absolutely does. Yes, which is great when it comes to that one too. Because again, it's one of those of making sure across the states that there are some model procedures so that are some uniform, if you will, across the state and how these incidents are being reported up to it, what type of information is being reported to it, how it's being investigated, things of that nature that come to it. And then on the back end of that, every quarter, then they are required to report to the commission all those incidents that came up to it. So then we are able to have that data. We can look through it, see if there are trends, see if there are issues. What is it? How do we look into that? How do we quality control? What is there? Are we seeing trends? Are we doing those? I'm thankful we have new data analysts as part of this one too. They can help with that journey. Yes, every quarter they are required to submit, and that is the form on this lab page that is proposed to be done of what could be submitted up to the commission so that we can formally look at that and see if there is anything, a trend that needs to be looked into further.
Real quick, there's also in the subsequent, I don't know what page it is out, but it's right before I think the table in here that basically shows the provider, it's a green table, that shows the providers that will be impacted, basically required to do those quarterly reports. We divided them into two groups. One is these counties that are basically providing paratransit services under our program, and then those that are public transit agencies that are more on the federal side, doing ADA paratransit or other types of paratransit services that really kind of fall outside of our direct oversight, but that would be meeting the statutory definition that the legislature put for reporting.
This is a topic that we discussed at a couple of our meetings over the summer as well too. How to work through it, what's the best way we need or we not need. There has been discussion on it too about what type of information is reported to it, making sure that it's not personal identifying information as well in that one too. So that guidance is also included in this one. It's more along the lines of minor one or brighter two, or putting it into those terms of the incident rather than personal identifying information, because that was brought up earlier as well too. So listen to that feedback to make sure we can address those concerns. Yes, ma'am.
So in reading through this a little bit, and I went through 13B a while back, is this report, I see that it's same individuals or the same CTCs and coordinators that would be working with seniors, but is this reporting specifically towards individuals with intellectual disabilities or disabilities, or does it also cover individuals who are seniors in this? Is that something that needs to be looked at or amended to make sure that all aspects and all providers and CTC system and transportation dispatch system are covered?
I think on this one, as we're looking towards that, great question for that one too. It's any adverse incident that occurs on that system for that provider. So whoever they are providing that service to, if they reported an incident, if the provider reported it, or if it was reported in a different way, would need to be reported on this type of form through this procedure. Does that help?
It does. I just want, like I said, seniors are one thing, but then we're also talking about underage children, and I don't see any representatives from my gal here, guardians of life. So there may not be a representative. I don't want to make sure that we're also capturing those individuals if there's an adverse incident and they're using the transportation system.
Right. So, and in this one, if we're looking back at the statutory language, it's transportation service provider. So an entity that contracts with local government to provide paratransit is where we are for this one. But if we need to look at that more as to expanding it and seeing how that works and how this reporting mechanism is coming into play, useful information, ways to hone in on the better pieces of information and data, I think that's something that we should have. I appreciate the clarification.
So we really don't have a definition of an adverse.
Because we're just starting. Because I will tell you, please, sir, to correct me, when we had the conference just a few months back, there was a session that I think that Assistant Director Karen led, Somerset led, and it was, well, are we just gathering complaints? I mean, like, they really, how nitpicky is it going to be, I think was a lot of their concern, because no one was violated, right?
Correct.
That no one's violated. So they were really looking toward the commission to make as clean a definition as possible without there being such a definition. it's kind of riding a very, very careful line there. So and the most important part for the commission is just to make sure the records are maintained, right? Whatever they give us is what they give us.
So you do incidents, although include accidents,
That's just what it is.
injuries.
And an incident by definition could be that, right? But we can't tell them.
You can have conflict with the driver, you know, screaming at the driver, hey, you missed my stop or something, right? Or you can also have somebody who slips and falls or.
Anything that adversely affected the rider.
But I think we kind of want to know that information now, as you were saying, because going back to the fact that there is no customer satisfaction, to our knowledge, included in the formula. How do we make sure until we know what's being reported up? Obviously, we don't want anything to happen from like a accident perspective, but if there's consistent issues with consumer satisfaction, we need to know that too, as we're thinking about the future of the formula.
Right, and creating those ways in which we can learn that and have that come to the commission, to those decision body makers that are making this to at the local levels too, because they'll also have the access to the information now too that has been reported on.
I think the advice we gave is just to err on the side of caution, just report whatever you think it could be. It may not provide consistency across the board, but in your, whatever you think could be. Because we can list it, because the list would be just, it would not be exclusive.
And it's one of those of a year to see where it's going. What does this look like? How are we getting this off the ground? How do we best make that look for the state so that we can have the most important information coming up to us? And right now it's all, if you look for that too, so that we can then drill down into the most pertinent information. So any other questions on this? So at this juncture, we can either approve the adverse incident policy as drafted, or we can table this discussion. And it does seem like we do have a lot of questions, and I know many of us are new. To the next meeting, to allow board members more time to review and only discuss in the sunshine. So what is the pleasure of the board? I'll defer to the new members. Does anybody?
I mean, when does the reporting start? It starts for January, right?
So they're still collecting the information, they just don't.
So this is what would be put out there for them to adopt and to make sure that their policies and procedures, if they need to look to a source of how to make a model policy, how to bring those up to speed if they don't have them yet, or if they don't have them at all, what does that look like? How do they put them into action? But then, yes, beginning in January is where we're hoping, and it's been told to them that they need to start reporting up at the end of that quarter. So they would need to start collecting it in January.
And they've been working with y'all for months on this, and we've had this for, I'm comfortable as a new member to move forward with it. So
They are aware that this is coming out there. It's been a part of the legislation, part of the process of what's coming to it.
And we can make changes to it even halfway through the year, but just then that would be the trigger for the new reporting, correct? If we are wanting to make changes to this one, and Rochelle, you can correct me on that one too, I, as the board, as a body, could come back and address any necessary changes that need to be made to that. Yeah, it's based on feedback.
Commissioner Tellez sent a message in the chat box.
You say and table it until the next meeting.
Okay, so I guess we have both sides of this. So do we take that to a vote, or what do we do with this then?
Honestly, the meeting is, it's in December, so I think if you have one or two commissioners that still feel that they need to digest this a little bit better, then it's probably, I would recommend that you table it so they can digest it, knowing that when you come back in December, you have to be prepared for a vote.
Yeah. So is there a second commissioner who would like to table it?
So
Got two. Okay, so I think the will then, or advice on council, is to table it until next meeting, but everybody does need to be prepared to vote. So in the meantime, where are questions? Yes.
So the vote that will occur at the December meeting, it appears, is going to be whether or not to accept this document as the model procedures document. Okay.
And begin the quarterly reporting starting as January, beginning, that will be the first quarter, is that right? Commissioner Smith?
Quarter start.
Right, January to March.
Start in
Yeah,
January,
for the
so that
first
it would all need to be due in March. And that allows for, so if this was approved, that would be when it should be able to start with that, so we can start gathering that information to come into it.
So this is the proposed language. We will table the vote until the next meeting, but every
body needs to be prepared to vote at that meeting. So in the meantime, who should commissioners direct specific questions to?
To staff, so
Okay.
to me, Karen, and we would, or Rochelle, but we would be.
And please, suggestions are helpful. I mean, I was just thinking, I know the document is titled Model Procedures on the front, but the procedures are these procedures.
It's all one document, so page 1, 2, and then the guidance that would come into it. So how it would come into it. Okay, so this item is tabled.
That the agenda will call it an action item.
Yes. Yeah, typically we do divide the agenda, just for your reference, we do divide it into action items and information.
So that folk know what they're coming in to vote on.
Yeah.
As I recall it, that is Robert's Rules of Order. It's been a little while, but I'll get back. All right. So I think that concludes the business of this meeting. I'd like to now open it up to public comments. We will now provide an opportunity for attendees to provide public comments. The first call on speakers who submitted a public comment card. For those on the webinar who wish to provide public comment, please indicate in the chat bot and we will call on you momentarily. All speakers are limited to 5 minutes. So do we have any speakers?
We have one.
One.
That is submitted early.
Okay.
Chris Stevenson from Indian River County Senior Resource Association.
Hi, can everyone hear me?
Yes.
Yeah.
Hi, I'm representing the Senior Resource Association. We are the CTC in Indian River County and in Martin County. And I'm sure I'm not going to be the only person to say this today, but we know it's David's last meeting. So we just wanted to thank him for all of the support he's given us as the CTC over the years. We've received, going back many years ago, we've received mobility enhancement grants and innovative service development grants over the years. And David has always been a huge champion for us on the Treasure Coast. And so we just wanted to make sure he knew how much he was appreciated here on the Treasure Coast.
Thank you, Chris.
Yes. That was nice. Okay. Do we have any other public comment?
Yes, good afternoon. Can you hear me?
Is that, oh,
Yeah. Yeah, we can hear
we have
you.
a
My
hand
name-
raised and then we have someone talking. So is that?
Yeah, that's Julia.
Julian can go first. I'm sorry.
Leah?
Hi, just getting the mic. I had a question about the previous agenda item. At what point do you plan to discuss the language that was kind of murmured about adding the adverse incidents to the TD trust fund formula? Would that be something you take up the next time you talk about that item or at a later date? I have significant concerns about adding anything else to your formula. Thank you. And that was question 1. And question 2 is, thanks, David, and I wish you well.
I mean, thank you, Julia. I know it was a suggestion about it's part of considering, I think, what the impacts of these services, but I don't think it was necessarily the adverse incidents that are being considered approved to be incorporated in the formula.
That is correct. So those were 2 separate items. And so that was not a discussion point. So the voting on or approving the adverse incident is separate from the discussion that was on the funding formula, which I think was more of a Q&A and people trying to understand how that worked. Does that help?
Yes, thank you.
Okay. There's another hand, but I cannot see who it belongs to. So can someone help me out?
Yes, my name's Adolfo Cavalli. I'm the transit director in St. Lucie County, also in the Treasure Coast. And I just like to echo what Chris Stevenson said about David. David, I want to thank you and wish you well. You've made such a tremendous impact in our county and in our Treasure Coast area with the trips that we provide for these individuals. I was grateful to come to Tallahassee with you last January, and we're going to miss you, and we really want to thank you for all you've done for our county. So thank you so much.
Thank you, Adolfo.
Commissioner Teles's hand looks like it's up. You may want to prompt.
Oh, okay, Commissioner? She's clapping. Oh. Yes, that was nice. Okay.
You got.
There is another hand, but I don't know who, is that Commissioner Teles's hand or? Any other public comment then? Okay, well, I would also like to say nice things about you, even though we just met, but that's okay. So I got a little write-up here on you, so I'm gonna use this, but David has dedicated 15 years to the Transportation Disadvantage Program, providing strong leadership and advocacy for those in need. Thank you for your hard work and commitment. You'll be greatly missed. Wishing you some well-deserved time to relax and enjoy life. So it's clear that many are very appreciative of your service, and the amount of time that you have spent here is a testament to clearly your dedication to this cause. So thank you for that. And I know this is your last meeting, but I think everybody here wishes you the very best. We know you will do wonderful things in the future. So
Thank you.
does anybody else want to add to that? Because
Thank you so much, David. It's been awesome working with you. And I really appreciate all the information and the guidance. And yeah, it's been a wonderful experience. Thank you so much.
Thank you all. Appreciate it.
David, just wanted to say thank you as well. Personally, thank you for how you educated myself and our team as well. And on behalf of the agency, really appreciate all your positive contributions and your heart that the chair just spoke to, I think is evident in the day-to-day work. And you're always open to new ideas and challenging. So we know we can always be better in every single sector, that we work within. And that is so much appreciated. Just how you've embraced not only our agency, but the people that we serve, lifting them up in a very big way. Thank you.
Can I just say I appreciate that, but also, I worked at APD for a little while before I took this position. So I'm thrilled to hear under your leadership that employment and transportation being woven into that is going to be a big theme. So it just warms me because it's been one of my passion projects. It never left me. Employment and transportation always connect. So I'm glad to see the agency's moving in that direction of promoting more of those opportunities. So folks like myself can do this kind of work.
Thank you for your kind words.
Well, I think that concludes this. Oh, wait, we need to, sorry, I almost missed one. So the last item is starting to schedule our next meeting. I think it has been suggested December 11th, but at this time I am going to ask staff to coordinate with each commissioner to make sure that that works. December 11th is the date that is being proposed. So staff, I think, will come back to you and make sure that that date works and we can get a quorum on that date. So at this time, I would like to close this meeting or call the meeting. Right turn. What? Oh,
I just got one quick question. When we decide the date, going back and forth sometimes gets to be a lot to make everyone on the same page. Also, the time of day, does anybody have a preference? Or I'll let Karen maybe give any comments about how you want to make this make sense. Or
I think I'll email everybody and ask them what their preference is. Probably with you, Michelle.
the 11th is open because you have
All day on the 11th. Okay. I don't think it'll be a very long meeting. We're basically going to be looking at the annual report and the adverse incidents. Probably action items on that. And it'll be virtual unless you all want to meet in person. Being that's close to the holidays and all, I'm not sure if your availability is.
Do you guys offer it in person for those who live in California?
Absolutely, we can do that, yes.
Yeah.
You could have it in this same room or at Burns Building. And
right.
For those who can't make it in person, virtual option.
Virtual.
Yeah.
okay.
Is the 11th good with everybody?
It's looking promising.
Maybe.
Pardon me?
No, I was wondering if we could maybe afternoon instead of morning, so if we wanted to come, it would be easier.
I have a conflict in the afternoon, but I don't know what. Yeah. I'm sorry. We could do like 11. That work? Yeah. Right.
Here we go.
Director David Lee.
Oh, where does all this go?
It's okay. I just, this makes it less. Or we to do whatever needs to be done.
Okay, so last I did it. Here we go. Okay, so before we conclude, we need to appoint an interim to serve as executive director. Are there any objections to appointing Assistant Executive Director Karen Somerset to this interim role? Seeing no objections? Thank you, Karen. Oh.
Only because I want to make it official and so everyone has to vote. I don't know what Ms. Celeste, Commissioner Celeste said or did, so.
Any objections?
She's not there.
She left.
Okay, well then that's, I can't say, okay.
Okay,
Thank you.
no objections then, so thank you, Karen, for agreeing to serve in the interim role. We appreciate it.
Ma'am?
All right.
Good job. First meeting.
I almost missed two important things, so my bad. So we'll get better. At this moment in time, this meeting is adjourned. Wonderful rest of your day.
People folk like. Going through the woods, then you gotta go that way. Yes, yeah, FH. They just finished the MOB part. They have some. Get rid of. Information man.